Ontario Shores is a tertiary mental health facility providing specialized mental health and addiction services. Recognizing the value that an electronic medical record brings, the decision was made in 2007 that we want to move towards having patients' records be electronically captured.
CIHI, Interdisciplinary, and the CIHI at a point in time actually got together in terms of a partnership to actually develop the way in which the RAI tool was going to be used in Ontario.
In 2012, we integrated the RAI assessments. That really took us to a place where we are currently a fully integrated system, both for our inpatient and outpatient, and we're a paperless organization.
We are able to drive off of our medical record because we've got an embedded RAI. And we were able to do that because of the relationship that we were able to create between our vendor and CIHI in terms of the specs.
One of the great things about the RAI Mental Health is that it's really a comprehensive assessment of a person's strengths, specifically focused on the adult in the inpatient mental health setting. And as such, it's perfectly compatible with our recovery philosophy here at Ontario Shores. I think one of the things that's most impactful for me is that there's a continuity of the assessment goals across all of the different areas that it can be deployed in, whether that's in the community, whether it's in home care, whether it is in acute or even post-acute care. That process works really nicely.
The RAI admission assessment will help provide a multidimensional view of that patient's current situation and life experiences. Before it was integrated in the system, it was quite cumbersome for the clinician to complete. Now that it's integrated, it's an easier process that will pre-populate in some sections of the RAI information that already exists in the medical records, making it more timely and efficient for the clinician as well.
So when I open up the RAI, the outcome measures and the CAPs are built into the care planning module within the electronic health record. When the CAP is triggered, the clinicians can add on the treatment goal and collaborate with the patients, gather in the conference and bring all that together. And over time, hopefully when we do the next RAI, that CAP will no longer be triggered. We're able to make the little outcome measure assessments that were inside each RAI and make them their own assessments. For example, we were able to take out the aggressive behavior scale. We can use that as a measurement tool that can be captured more frequently with just completing the 4 questions to give you a new output as opposed to waiting till the next RAI, which could be another 3 months.
Completion of the RAI at Ontario Shores is a multidisciplinary approach where frontline nurses are completing several sections. Other sections may be completed by the social worker, the psychologist, as well as the psychiatrist.
What's worked well as a psychiatrist is the sense that in building the EHR the way we've built it, that the automatic flow of information from some of the assessments that our clinicians are doing as part of their regular workflow feeds the data of the RAI, and that then generates the CAPs, which can influence the care in that patient's current admission. Rather than having to wait for the data to come back to us on a quarterly basis, it allows our clinicians to do the great work that they do without having to double document, without having to ask the same questions over and over again to our clients. And our clients, of course, they're ecstatic that they're not being asked the same information over and over again, that they're getting care that's actually custom made based on the information that they provided in their assessments. And as the change process happens, as they report change, that information actually modifies the RAI.
You can't really build on quality initiatives without a solid foundation in information, right? And a solid foundation in being able to look at data. And CIHI is a very important part of that relationship, and being able to know that we can get good information, timely information, and that we have comparative data. One of the important initiatives that for freestanding psychiatric hospitals, CAMH, Royal Ottawa, Waypoint, and Ontario Shores did was develop a quality report card that we're calling the Mental Health Quality Initiative. And that report card was information that had been brought together by these 4 institutions for comparative purposes. And so initially, it's easy enough to do on our own. But if you want to be able to do that regularly, you need a good method to collect the information. Then you want that information to come back to us in a usable format that you can compare, and that's where really CIHI's talent lies. And so we worked very closely with CIHI to actually develop the reporting mechanisms and the collection mechanisms.
We have now a business and clinical intelligence tool that also brings that information to our leaders to be able to have more comprehensive understanding of the effectiveness of care based on the data that we now have available to us. For facilities that haven't implemented the CAPS or the outcome scales, I think one opportunity that really exists is this gives us a comprehensive way of being able to assess people that we're treating and being able to understand their trajectory of their illness as well as inform the treatment plan. Historically, when we weren't using the outcome scales, we were just doing care because that's the way we knew how to do it, versus now we have the opportunity to really have informed clinical decision making at the point of care level and really be able to focus on the treatment that patient actually needs based on these validated scales.
We needed to make a care plan. We needed to know what was happening with the patient. And I think the REIs and the CAPS provide objective feedback to help validate the care plan and give the patient some hope to see that there's actual numbers to show that they're getting better, the treatment's working, and there's effective practices being performed.
Important critical steps after that included ongoing training and development of education to support reporting and from our staff as well. So I think those are some of the things in terms of value that we have seen in our relationship with CIHI.
This is just the beginning of the opportunities to exist in allowing mental health care to start learning from each other, essentially to be able to improve quality of care and support the patients the best that we can in the treatment that we're providing.
It's an important part of leadership to have data in front of us. It's an important part of leadership to have partnerships with organizations that share a willingness to actually work with you on a variety of different initiatives. We organized an event some months ago as part of a larger group of hospitals that were providing psychiatric care, and CIHI was one of our partners at that table. And so we need those types of partnerships where people are not only engaged in the data, but are also engaged in understanding how the data is being used for quality purposes and for care purposes, and what they can be doing to shed greater light on that process. And so I think that's why we value having CIHI at the table, is because we have a partner that's prepared to work with us around the needs that our organizations have around information, but also around what else we can do with this information.